This video is only an overview of issues and suggestions to discuss with children. The Huntington Society can provide literature on this subject. Feel free to contact them or visit their website. Even though it's difficult for parents to talk about bad news with their child, it is important to talk about the disease and the changes it may cause in the affected parent or grandparent. Children will notice changes, and if they're left without any explanation, they may imagine things to be worse than they are. Here are some suggestions. It's important to tell the truth, but not necessarily the whole truth. Children ask specific questions. You can answer them without saying everything you know. It is advised to leave the child time to understand and ask questions and to answer them as they're being asked. It is normal that you do not have all the answers. It is advised to tell children what you do not know and that you will try to find out. It is good to prepare for such a conversation with the child. When the time is right, this will help you remain calm and listen to the child's concerns. Here is the type of information that should be revealed according to the age and personality of the child. For children under 6, the child should know that the disease is not their fault. It should be explained that the disease is not contagious, so you cannot get it through kissing, touching, or sharing a snack with the affected person. For ages 6 through 12, children of this age are ready to learn more details. They can understand that the disease can have several symptoms at once. Simply explain the different symptoms. Teenagers. They should be talked to like an adult, but they should not be given all the information at the same time. Above all, they must be told the truth. You need to respect their need for privacy and understand that they may not want to talk about it. At the beginning of adolescence, teens begin to understand genetics, and it's important to talk about the hereditary aspects of the disease. If not, they may find out about it on their own by listening to a television program, in a biology class, or on the internet. Several reactions are normal in children. They must be given time to process the news. They may experience shock, worry, fear, sadness, or denial. Children may also show anger and frustration, which may lead them to feeling guilty about being angry. They may feel afraid of losing their parent or grandparent and may question about their own risk of being affected. Children may feel embarrassed about having a parent who is different or who acts differently. They may then stop inviting friends over to the house and no longer want their affected parent to take them to school or to attend their recreational activities. Children who grow up in a household in which Huntington's disease is present face several challenges. They may help out with the care given to the affected person and take on some responsibilities that are usually reserved for adults. Their free time may be limited and their social life disrupted. However, the disease does not need to take over the young person's life. They need to feel safe confiding in someone, whether it's a parent, a friend, or a teacher. For very young children, talking to a pet, a stuffed animal, or doll may help, whereas older children may draw or keep a personal diary. You must make sure that the child does not have too much responsibility and that they have free time with friends. All children need clear limits and constant discipline, even when the family situation is difficult. Positive interactions between the child and the affected parent, as well as family activities, are encouraged. Here are some suggestions: looking through family photos, reading stories, or sitting down together to watch a movie. If the child is not doing well, if schoolwork is suffering, if they rebel or become depressed, talk to them. It's also recommended to seek help from a psychologist. It's also advised to inform the child about resources that may help them out in the event of crisis, such as Tel Jeune and Kids Help Phone. These organizations offer prevention and intervention services to young people from 5 to 20 years of age.